Welcome, everyone, to the International Arthrofibrosis Association's interview series. I'm Dr. Kaylee Usher, the founder of the International Arthrofibrosis Association and adjunct lecturer at the University of Western Australia. Catherine is with me today to talk about her experiences with knee arthrofibrosis after a total knee replacement, which is also known as a TKA or TKR. It's a common cause of knee arthrofibrosis. But any knee surgery or injury can cause arthrofibrosis if the healing response becomes dysregulated and continues to make the contractions, adhesions, and scar tissue. So try to picture this. You're a highly motivated sporting person and you're a month out after having your ACL reconstructed. You have enthusiastically embraced physiotherapy and you're looking forward to getting back into play. But things aren't going well. Your knee is painful, it feels really stiff, and it won't go straight. Walking and even standing increases the pain. So, what's going on? Your doctor tells you not to worry, it's just stiff. And your physiotherapist tells you to push harder with stretching and exercise. You're probably not doing enough, but you really are. And when you follow their advice and you push harder, things go from bad to worse. And you wonder if your knee will ever function again. Then you stumble across the word arthrofibrosis and you learn that it's a common complication of knee surgeries that you were never warned about. This is just one story among thousands of knee arthrofibrosis, but they all have common themes despite some differences in symptoms. So, as we're going to talk about knee arthrofibrosis, Catherine, can you tell us about your knee and how it feels?
Right now, I'm sitting with my leg propped up, so they're both elevated, so I'm not weight bearing. So it's actually relatively comfortable. I have a hot water bottle on my left knee, which is my sore knee. I've got a hot water bottle on my right hip. Also got one on my feet. I'm mildly medicated, and that's unfortunately become part of my new normal since I've been diagnosed with arthrofibrosis. The pain of part surgery has diminished a lot, and it's a lot more comfortable on a daily basis. But I do need to still take regular pain medication because there's a level of heaviness. That's probably the best way I can describe it. That's lingering. I had a total knee replacement 13 months ago. And then I had two MUAs to follow up. And ever since then, I haven't been able to bend my knees.
Can you maybe walk us through how that went for you? So, did your symptoms become worse after every MUA? Were they there right after the TKR?
I didn't rush into a knee replacement. Used to run every morning and row. That was part of my routine. And wear and tear, I'm 53 years old, started to get a little bit much. So during the past 5 years, I've had meniscus repairs, 3 of those, a couple of cortisone injections, and that all did help with the swelling and the pain at the time. But I was always told that eventually I'd need to get a knee replacement. 13 months ago, I proceeded with that, consulted a couple of different surgeons to make sure I was doing the right thing, got the knee replacement. And then after that, my progress didn't seem to go well as far as recovery. I did all of the prehab work leading up to the replacement because I wanted to make sure I got the best result. After the replacement, I did all of the rehab work with physio and then also at home care. But I just wasn't getting the same results that I think were expected. I was lacking a lot of range of motion. There was still a lot of swelling. There was a lot of redness. The pain was still quite bad. And I just assumed that was because, it was major surgery. So it felt like, okay, well, that's normal. My recovery included having a game ready machine at home. So I did all the icing and everything that I was asked to do following the instructions. I diligently followed and thought, okay, I'm on the right track here. In 12 weeks, I'll be up and running and it'll be fine. I was told was to have a manipulation under anaesthetic, and I was told that that's going to help increase the range of motion. So I didn't really have too many problems with my extension and getting it straight. But bending my knee and having that stiffness, it was just, super, super stiff. It just wouldn't go. So the MUA, I was told, would help with that. Use a CPM machine, passive movement, that would be gentle, and I would progress and my recovery would be better. So I had the first MUA, and persisted with the regime of physio afterwards, persisted with the regime of using the CPM machine, and the pain wasn't getting any better. It was actually getting worse.
How about your range of motion?
The CPM machine, the range of motion was increasing, and I thought I was making headway. But when I went to physio and they measured it properly with the scale, unfortunately, after another couple of months, I still didn't have any better results. I was told that, look, sometimes when you've maybe done a little bit too much damage in the past, you can have these type of issues. We're going to do another MUA. So I said, okay, what are the risks? Like anyone, you ask what that looks like. For someone my age, the risks seemed like they were relatively low. If people are a bit older, their bones are a bit brittle and there could be a slight fracture if we push too hard, but that won't happen with you because you're young, you're healthy, you're fit. Let's just crack on and get this done. So I was told about some of the risks. Having that one, which was in January this year, has changed my life fundamentally.
Not in a good way.
No, not in a good way. From a surgical intervention point of view, I completely understand why I was encouraged to do that. It feels like there's not enough known yet about arthrofibrosis for the medical fraternity to respond in a way that is not necessarily conventional. And by that, I mean the second MUA left me in a predicament where my knee was not only super stiff, my patella tendon was torn and damaged, my patella itself was stuck to the skin and remains that way, and it tore through the skin. So it was, it was pretty traumatic. That was the first time when I woke up after that procedure that I heard about arthrofibrosis for the first time. For me, what it meant was I needed to wait for a period where the inflammation would settle, and then that looked like potentially a year. And then after that, I could get surgery to repair it.
It's very unfortunate that MUAs are still the first line of treatment for arthrofibrosis because it is actually quite well known that they can and often do quite serious harm like you have experienced, which leaves you in a very difficult situation. And there are better ways to manage arthrofibrosis, in my opinion.
Looking back, if it wasn't the surgery or the procedures, in my opinion, I understand this is my body's response to the trauma being surgical or whatever else that is.
Sure. And
difficulty that I try and get my head around is, it's the first sign of madness. I think they say that if you keep doing what you've always done, you're going to keep getting what you always got. So, if I look back and try and think about, well, what should I change? What could I have done differently? Maybe asking for additional imaging doesn't seem to be a definitive test that says, hey, look, in red lights, you've got arthrofibrosis and therefore we need to treat you differently. It's all still a learning curve for me to understand how to navigate through that.
It is a diagnosis through ruling out other causes like fractures, etc.
Yeah.
Got a stiff, painful knee and everything else is ruled out, then it's by definition, it's arthrofibrosis.
Yeah.
But you're correct. We don't have a definitive method to, like a biomarker to test or diagnose it definitively. So were you warned that arthrofibrosis was a risk of having a TKR?
No. Never heard of the word. Didn't know what it was until after the second MUA.
You even though you're young and you're fit prior to this and healthy weight, so weight is not an issue really in this whole story, and that's common. You do actually have some risk factors such as multiple surgeries beforehand, procedures.
I had a bad car accident when I was 18 and had multiple fractures and particularly in the same leg. So I broke my femur and my tibia, and my knee hadn't, I thought, in my opinion, really given me that much grief over the last few decades. Yes, it started to play up in the last 5 years, but, other than this, I guess I thought in consideration of how many people get knee replacements every year, it seemed to be a common thing. You get old, your bones start to deteriorate, your joints start to wear out. If you run a lot or something like that, then, the chances of you increasing that and bringing that intervention in earlier is going to happen. So that's where I thought I was.
Yeah, unfortunately, early onset arthritis does seem to be a risk for arthrofibrosis post-op
Mm,
as well.
mm,
So yeah, having a TKR relatively, well, quite young,
mm,
is a risk factor, and we're
mm.
still trying to unpick why that is. Yeah, it's obviously had a massive impact on your life. Can you describe your day, how you get about living?
It's yes, I'm laughing because I was thinking about this question. I was talking to my husband about it, and he probably wrapped it up very succinctly by saying, it's more like what hasn't changed. So my life is unrecognizable to what it was before. I'm now disabled, so I have a very pronounced limp. As I said earlier, my extension seems to be okay. So I've got strength and I can straighten it, but bending it, it's super stiff. So I get now between 30, 35 degrees bend, which is not enough,
Wow, yeah,
to
that's
enable me to
barely
walk. Yeah.
barely bending at
Um,
all. Yeah.
yeah, that's right. And so with that,
Mm.
it's meant a lot more weight bearing and load bearing on my right side. So that hip is now starting to, feel that pain. As far as basic things like self care, putting on socks, going to the bathroom, all of those kind of things are very difficult now. And I think that's probably, sorry, Kaylee,
That's all right. Take your time.
I keep telling myself every day that, this is a first world problem and that it happens to a lot of people and that there's a way through it. I think the changes that have happened in my life have been astronomical and probably difficult for me to digest because of the sense of frustration of this is not an unknown thing. Yes, it's a complicated condition, but there is awareness out there, albeit small, of the condition. And knowing that and not being able to fix it is difficult.
Mm. I think a lot of people would relate to what you're saying in that it's not just the pain and frustration of not functioning, you're also dealing with a loss of identity, a loss of job, yeah, a crisis in your independence. The whole picture is pretty massive to take on.
I have not been able to go back to work. My job used to be the center of my universe, really. I used to travel a lot for work. I'm supposed to be, planning for the UN conference for climate change in Brazil in a month's time. I've had to cancel that. Like anybody does, you have your days where you have a really bad day and then you try and pick yourself up. I am a glass half full type of person. So I've tried to think to myself, okay, look, this is a challenge and it's the biggest one, I'll be honest, I've ever faced. Um, there is going to be a way through this. It's not going to be linear. I'm enormously impatient, which also doesn't help because nothing happens quickly anymore. And you're right, my lack of independence now means, forward planning like a covert operation just to get out of the house. I am hopeful that I think with the right care and my understanding of what risks are, there's going to be a way through this, but I'm also acutely aware that this is a lifetime situation. This is not a transactional thing that has happened and it's going to be fixed with one surgery.
And patience is definitely the key. Nothing happens fast, unfortunately. Once you're
Mm,
in this situation, there's no quick fix,
no.
including MUAs.
Yeah. Yes.
So, what was your experience with finding treatment once you realised the situation you're in?
It pains me to say, my personal lived experience has been to look everywhere outside of Australia. Australia is dealing with patients who have arthrofibrosis in a very transactional way. So my experience has been, okay, you've got it, we'll wait till it settles, we're going to do another surgery. You can see a couple of different people and try and get a couple of different opinions, which all came back pretty much the same, which is okay. The part that's not okay is that I found out, thanks to the IAA and my husband stumbling across your website saying, look, there's all this other information out here, and really understanding and digging deep and doing a lot of research ourselves around this is a condition. It is not a broken bone that you can fix with a transactional orthopedic procedure. It's a condition I'm going to have forever. I need to think about, yes, having surgery to give me more bend and enhance my quality of life. But there is no point in having that surgery if the wraparound services are not there to support it. I'm not a medical professional, but I am a patient who is living this day after day. And it seems like it makes perfect sense to have that wraparound multidisciplinary approach,
For
because
sure.
everything from the pain management side to the physiotherapy side to the rheumatology side, the radiology side, even with the imaging, all of that, when I look at it together without a care team looking at all of that, I can't see how I'm going to get a different outcome if I have another surgery.
For
So,
sure. Yeah.
yeah.
And there's a lot of differences in the approach to between arthrofibrosis and healthy healing. So in a healthy healing situation, you can get away with things that you just can't with arthrofibrosis. So you really can't push hard doing exercise or stretches because the tissue is highly sensitive. It's very easily damaged, and doing more damage to it just inflames the situation further, it feeds the fire. So, and even with surgery, they need different approaches. So they need to understand the pathology of arthrofibrosis. This is a serious pathology, bleeding, nerve damage, um, things like using a tourniquet can create hypoxia, which is highly feeds that cycle of fibrosis. So avoiding tourniquet use, closing off all the bleeders, minimal surgery, all of those approaches that need to be adopted when you're treating someone with arthrofibrosis.
Your association and the experts that you um, have got so much knowledge around the impact and how the patient pathology is just different. And so now I think I'm at the point where I've started to have consultations with doctors overseas who understand and who do this day to day. That's what they do, they treat it. What my plan is for my next steps, it's absolutely around, yes, unfortunately, I know that having surgery is a risk. I'm aware of that, but I also am aware of my quality of life now. So
Yeah,
I don't feel like I have much of a choice.
for sure.
So having surgery, but in the right setting. We have some fantastic surgeons here. We have some fantastic hospitals here, great physios. However, I say that with the caveat of there is no point in me having another surgical procedure here if the wraparound services aren't going to be there. So it looks like I will be having surgery in Europe. I look at that as, maybe 15% of the next step, because everything in the way that they perform the surgery, and equally the physio and the follow-up afterwards, as much as the pain management side before, during and after, I understand now is really important for a patient like me. So I need to make sure I give myself the best chance of success.
And what was your experience with physiotherapy here, finding good care with your arthrofibrosis?
The physios are absolutely, geared towards wanting to get you back on your feet. And I respect that fundamentally. I've always been told no pain, no gain at physios. So, push through, take some more painkillers before you go, taking morphine before I went to physio to try and block out the pain a little bit more and push through it, because that's what they know and that's what they understand. The awareness is not just for patients. It feels like there's a much greater level of awareness that needs to be had for healthcare practitioners universally. If you have arthrofibrosis as a patient, because they're liaising with your surgeons, because that transactional approach of surgery, physio, crack on and start, living your life doesn't work, you just end up potentially doing more damage, and it's a lot of pain.
We really do need to coax the body into healthy healing and not just think that we can force it to do what we want. And you just have to force it hard enough and you'll get to where you want to be.
Yeah, and unfortunately, that's my hard wiring. That's my DNA. I've always lived life that way. Just go hard, push harder, work harder. It's going to get there. You just need to stick at it, be diligent.
Well, I guess one thing you have learnt is to listen to your knee and back off anything that makes it feel worse.
With the information that I've learned that's been new around from physios overseas who specialise in not just arthrofibrosis, but arthrofibrosis and physio for your knee has been a big eye-opener for me.
So are there any other tips, like things you would avoid or things that you would do to help people with arthrofibrosis?
I would suggest that if you are having a knee replacement, it doesn't go the way you thought it would from a recovery point of view, and you're being super diligent with all of the pre-care and aftercare from a rehab point of view. If you've got swelling and you've got extra pain, and more to the point, like me, you've got really severe stiffness, potentially, have a discussion around what is arthrofibrosis with your surgeon and your physios. Have a conversation about, could I potentially have that? I know there's no definitive answer, but potentially they could do some pathology to have a look. They could also do some more imaging. I know that imaging is also a little bit of a sore point, and I say that because, it's difficult to diagnose with the imaging. Your radiologist really needs to be trained. I was very lucky to get a referral to a fantastic radiologist who did a great ultrasound and really understood the condition. So even though it wasn't purely definitive, it was a lot more definitive. And I think if you can get more imaging like that done before you embark on, let's say, a second MUA or even your first one, then maybe you could pick it up.
Yeah, good point.
Yeah.
And
Because
yeah, speak up. Don't be afraid to say when something hurts. And
yeah,
yeah,
that's actually probably the best advice. I've been working for 35 years in corporate. A big part of my job is around managing risk, and I think to myself, if English is my first language, I do a lot of research. I understand the conditions. What about the people who don't have that? What about the people who English isn't their first language and they don't understand, and they wouldn't think of, what do I need to research? What do they do? What does that look like? And it feels like it would be diabolical and quite scary. Ask questions, because you put your trust in healthcare professionals who want to do the right thing. And the way your body is responding is not their fault, but there's some things that you can do along the way until hopefully one day in the distant future, there's some type of diagnostic tool that can say, yep, you are 100%, you've got this condition.
and I'd say to any clinicians listening to this that the IAA motto is first, do no harm. Do your research and find out what the modified approaches are for treating arthrofibrosis. Well, thank you so much, Catherine, for sharing your very valuable insights and your story. Really appreciate that.
My pleasure.
And,
Really sincerely thanking the IAA. I did a lot of research, and so did my husband, about what my next steps would be. And being able to connect with people internationally has been an absolute godsend. Them making themselves available to have a discussion with me to understand, to help me understand the importance of not just having surgery as a transactional thing, but making sure that I have the wraparound services that go with it, has been fundamental to not just my physical health, but my mental health as well. As you would know, when your life changes like that fundamentally, you do sort of have a bit of a moment where you go, oh, hang on a minute, what's going on here? Is this the way it's going to be forever? And that has really had a very positive impact.
oh, that's so good to hear. Thank you. Thanks very much.
My pleasure.